done. Hey everybody, Dr. Luke Stringer, Advanced Health Chiropractor down in South Loop, Chicago. One of our favorite patients, Mr. Brian.
Hey.
Brian, if you could tell the people watching how you find us, or how you found us, the main reason you came in, how you've been feeling after treatment, how it's improved your quality of life, and then we'll get you going with some treatment.
Yeah, so moved to the city from the burbs. Was starting some care there when I was in the suburbs. Looked for another practitioner doing similar kind of work, so specifically doing a lot of similar methodologies, similar kind of supportive care around it. Got a recommendation here from someone else, so came in. It's been a great time. Came in with a pretty bad spinal state. Was at angles that spine should never be at. It's been months of care, but it's been really good. Spine's pretty much looking like a spine should, despite the heavy, corporate work life and the damage that tends to do to a spine. So yeah, it's been a great time.
Yeah, so Brian came in originally low back pain, some neck and upper back pain, and then some wrist pain. Brian's a corporate athlete, working 50, 60-hour weeks, pinned to his desk. So that took its toll on his spine, musculoskeletal system, overall spinal health. Brian's been a super dedicated patient, gone through a full corrective care program, adjustment, soft tissue, rehab, traction, trigger point therapy. Brian's feeling as good as he's ever felt. He's functioning at high level at work, at church, feeling like himself. So Brian's crushed it. We'll get you going with Brian's adjustment, full spine adjustment with some soft tissue treatment.
Yep.
Right on. All right, guys, let's get going. So, if you've watched our videos before, you'll realize or see that we use the arthro-stim. I love this piece of equipment. Puts movement into the spine, helps stimulate all the little muscles. Brian just told me he's been sitting for 18 hours a day, which is incredible. So we're getting into with the Hypervolt. It's a percussive tool, right? Using this for big muscle groups, traps, glutes, quads, hammies, all those big muscle groups that move us. And we get nice and deep into the upper head of the trap here. So we're just finding those adhesive spots, all that muscle tissue, it's all bunched up, drives a lot of musculoskeletal pain. Just breaking those down, get into the alleviator. Brian's spine, as he mentions, now nice and healthy. So Brian gets a full manual spine adjustment. There we go. Good. We're gonna hit the sticky spots in that CT junction, TL junction again. There we go, Brian. Good. We're gonna get into his pelvis. Good. We're gonna adjust that right SI joint. Come on through. Well done. This side for me, Brian. Gonna come under this hip. You got it. Good. Alrighty, we're gonna give Brian an anterior adjustment. And on YouTube, like call this the magic hug. Brian's spine moves well when he's adjusted this way, chin to chest. Do a little sit up, Brian. Big breath in, blow that out, relax, keep going, keep going. There we go. We're gonna adjust Brian's neck. Then we're gonna get into his wrist soft tissue. Good. Good. Brian has been pulling 18-hour work days. So he's been getting some corporate America wrist and elbow pain. So we're gonna get all these flexors in his wrist and his elbow, taken through the range of motion. Good. So essentially when you take a tissue from a short to a long position. Clean out all that adhesion. Good. All right, Brian, nice job. Yes. All right, guys, if you are watching on YouTube, subscribe to the page, turn on notification bell. If it's on Instagram, Facebook, like, follow the page. Brian, appreciate that. If you're suffering with pain and dysfunction, you want to get it corrected without the use of drugs and surgery, give Advanced Health a call. See you in the next video.